Thank you, Devin. And we have seen celebrities using the GLP-1 medications like Ozempic or Wegovy to lose weight. But what do these medications really do, and how do they help with diabetes? Here to break that all down is Nurse Christina Pears. Thanks for joining me this morning.
Yeah, hi, good morning.
Well, here we are, 1 week after the big celebration for the 10 years, and we're right back into it.
Yeah.
Well, again, congratulations.
Thank you.
It's, 10-year anniversary all year.
Yeah, that's right.
There you go. But let's talk about some GLP-1 medications. What does GLP-1 mean, and how do they work?
Right, so I get this question and had to look for myself because I really didn't know either. GLP-1 is actually a glucagon-like peptide. So our GI tract, where we eat food, it goes all the way through, is one of the largest endocrine organs in the body that releases more than 20 hormone peptides. And so one of the hormone peptides is GLP-1. And so what it does is about 1% of the cells in our GI tract give off this sensor, it takes in nutrients, and then it tells a signal to our body, okay, we've got enough food, we're good. And it also does things like slows our gastric emptying, so we feel fuller longer. And all of this started with a lizard, believe it or not. They found this hormone in a lizard that does all this, that blocks the GLP-1 or whatever. Yeah, so, and it actually started in the 1990s was when this first, the research was funded and discovered about the peptides. And then GLP-1s have actually been around for like 20 years, which I was surprised. But they said at that time you had to take them twice a day. Now most people only have to take them once a day.
Yes, and now they got a pill form as well recently. That's kind of exciting.
And there's Trulicity, we hear about Victoza, Ozempic, so there were others, so there are quite a few of them. It's not just the one.
Yeah, but speaking about all the positives that can happen with it, what are some of the side effects people may experience with this?
Yeah, so
there's always the good, and then you're like, all right, what could possibly happen?
And you and I were talking about that too.
Yeah.
So, of course, you're going to have some nausea and vomiting. The positive is, of course, a loss of appetite. But for some, especially people who are diabetics who aren't overweight, get concerned about the weight loss. Vomiting, diarrhea, dizziness. Some people can even have an increased, heart rate. You can get infections, headaches. And then we've talked to people who have had this chronic ongoing upset stomach, which, how much of that how much is worth the weight loss?
Exactly.
How much can you
I've known one person who's used the GLP-1s, and that was kind of what was going on with them. They stuck with it a while though. They liked the results, and then, at some point they were like, you know what? I feel just a little uncomfortable. And, that just happens. Every drug has a certain effect with each person differently.
And with these, especially if you're taking them for weight, well, even with diabetes, you've got to improve your nutritional intake. You still have to, watch what you eat, increase your activity level. So there are things that you still have to do to improve your overall health in order to get these to really work appropriately.
That's true, but some impressive medications, certainly.
Yeah.
So what are the complications when we should be seeking medical care?
Right.
When has it gone too far?
So, of course, some of the bad things that can occur is, some people can have allergic reactions. So you might have an anaphylactic reaction. Some people can have pancreatitis. So that's a very painful inflammation of the pancreas. Many people have to go to the hospital for that, so it's very uncomfortable. Thyroid cancer and some acute kidney injuries. So whenever we're talking about, blood sugar levels and insulin and, all of that can affect the kidneys as well. And then diabetic retinopathy, which is an eye condition.
Oh, wow.
And so that can be very serious. Yeah, of course, if you're having any symptoms of like hypoglycemia, which can occur, that's when your blood sugar goes dangerously low, below 70. And you're gonna feel kind of shaky, trembling. You might break out in a sweat or have chills. Your heart rate can go faster. So if you're diabetic and you're feeling like maybe you're having symptoms of hypoglycemia, please, treat that. You want to take in some sugars, call your doctor, and go see help. But of course, you want to talk to your doctor if you're taking these, and the side effects just become really bothersome. They're just more than you're willing to do. Also, if you think that it's just not working to manage your condition, whether it be diabetes or obesity, you're just not losing weight, or in diabetes, your medications, you're just not seeing a change in your blood sugar levels or your A1C. And also talk to your doctor if you're wanting to stop these. Don't just stop any medication on your own. Please consult your provider first. Some medications need titration and some don't. And then of course, if you become pregnant, they will take you off of this. It's just not known, what the implications can be. So, and if you're thinking about getting pregnant, always talk to your doctor about medications that you're on that maybe you need to come off of to protect that infant. And
right, you are. An interesting sort of look at GLP-1 drugs here. I know we hear about it a lot. I know I've talked about it, on the show for our medical segments, and it's always interesting to see it, in real life, and just to know that when things, you have questions, the provider is a great tool to ask.
They're also finding that it can help with cardiovascular disease too. So like high blood pressure, reducing your risks for stroke and things like that. So lots to come.
All from looking at lizards in the 90s.
That's right.
What a time. Where these things come from.
I know.
Well, thanks again for sharing with me this morning and all of us at home. It's been a pleasure.
Thank you. Glad to be here.
All right, we're going to be right back with your morning dose of What's Trending. Stay with us.